Hey, Dr. Stoker, let's talk about this facelift, Traceless facelift that you did. It's amazing. I feel like we need to go through all of your work.
Well, thanks for your interest, Quinn. It's one of my favorite things to do is look back at these beautiful cases, and it's most fun because that's a real person, and it had a really significant impact on their life, inevitably. And it just goes to show you the power that we can have with plastic surgery. So in this particular case, she's actually a nurse, and I'm always honored to have healthcare workers as our practice. I feel like we have a lot of patients who are doctors and nurses, even some surgeons coming in here. So what did we do? We did our traceless face and neck lift technique and upper eyelid surgery. And what I think is amazing on this case is that usually I would do even more than that. I would add in, a chin implant, or a fractional carbon dioxide laser resurfacing, or a lip lift, something like that, to get this dramatic result. But this was just 2 procedures executed very well. So the first one is the traceless face and neck lift approach. It's really important to do a couple of things when you do that. Number one is to achieve the goal of moving the deep tissues as well as superficial tissues where you want. Otherwise, there's no point in operating on them. The second thing is not creating some artificial appearance when you do that. So if you move it too much in one vector or another, and there are different vectors that you need to do for the neck and for the face, it can obviously look artificial. You spot it a mile away. Some people call it the windblown look. And lastly, it's those actual incisions or scars. The way that I do them using my traceless technique, I'm able to hide them in the shadows of the ear and in the hair, so that it's very difficult, patients tell me in many cases, even for the hairdressers, to tell that they've had significant work done on their faces. The other thing that is key is the upper eyelid surgery, and that's probably the biggest bang for the buck of any facial rejuvenation operation we do. In addition to having kind of a sleepy, hooded appearance beforehand, she's not getting any light refraction in her eyes. It's not sparkling in there like when you go to a jewelry store. They shine the lights down so all the jewels sparkle so that you'll pay more money for them. So what did we do? Well, in a very natural curvature, we were able to remove the extra skin as well as the deeper tissues, including a strip of muscle and a select amount of fat in that area to give her, what looks like about 20 years younger appearance to her eyelids. And I think with the eyes lighting up like that, the jawline really defined, the neck looking beautiful. And what I also see in this case that I should talk about is how she had actually a fat pad underneath her chin and mandible here. So there are different ways of treating that. As you get older, you tend to get muscle bands, laxity there. In this case, she has just a genetically predetermined fat pad there. But afterwards, she does not. So to remove that, we make a little incision underneath, and under direct vision, I'm really able to clean that out. And then by putting a lot of tension on with our traceless face and neck lift technique, we're then able to drape the skin over that and kind of shrink wrap that skin over her jawline without that fatty bulge, giving her the double chin appearance. So the one other thing that I think we should touch on, just to be really informative for our audience, are the jowls, because probably for you too, jowls isn't something that anybody in their 40s or 50s is coming in for facial rejuvenation. It's probably their most number one concern about what's bugging them, what do they notice is changing. And so it's really important to attack that well. Most of the time I do that with the synergy of multiple procedures, but as I said earlier, this case is kind of somewhat remarkable to me because I didn't do multiple procedures other than the upper eyelids and the traceless face and neck lift. It's just the procedure was done really well so that we were able to show off her jawline, clean out that extra fat. Her skin was still elastic enough that she didn't need the laser at that point, and didn't even require a chin implant in this case either.
Yeah, I feel like this tricked me too. I definitely thought you put a chin implant in her.
Yeah.
Like I had to double look at the case.
Honestly, I did too, because it's like it does look like that, but it's what's really going on is lifting that tissue, filling in that pre-jowl groove area by mobilizing the soft tissues and cleaning out a large amount of fat underneath her chin. It really changed everything around, and in fact, her eyes look so good. It's nobody cares about anything else almost on her. She's so pretty. So I'm happy for her.
Me too. She's lovely.
Thanks for asking me about one of my favorites.
Anytime.
This is Dr. David Stoker, board-certified plastic surgeon in Los Angeles. If you're interested in facial rejuvenation, you've got to check out our website, drstoker.com. We've got over 10,000 beautiful before and after pictures on there for you to review. Also check us out on our social media. We're active on Instagram, TikTok, and Facebook. And on our YouTube channel, we've got over 1,100 videos so far. Make sure you send us your contact information with your email or your cell phone, or simply email us directly at info@drstoker.com. It's Dr. David Stoker, board-certified plastic surgeon in Los Angeles.